think there are several challenges we're facing at the moment, especially in large countries, but not just in large countries actually, or in terms of the access to vaccines. You know, this vaccine, well, especially from the current available approved vaccines we have, they require a very sophisticated logistic system to provide them to the field. As you can tell, the vaccine developed by Pfizer requires -7-degree storage, and the one by Moderna requires -20 degree. So that is a huge, huge challenge. You know, even for regular vaccines, now we are providing the routine vaccines that we're providing to the most remote areas in Asia, in Africa, that require just very basic fridge, and even that is very difficult to fulfill. So let alone -20, -70-degree containers. So that is one of the main issues. And so that is to say, basically, it's not possible to send the vaccine, the current available vaccines, to like the most impoverished regions or the like tropical regions because of lack of electricity, lack of everything, so basically. And another thing is transportation. Currently, there are only like several production lines in the world, so you have to transport everything to different countries, and you can only transport them by air, basically, because of the all these have a limited time to ensure the quality. So currently, the logistics is from place A to place B, but from place B you have various like other places you have to transport by road, for example. So that will create another challenge. Like, you know, even if you have the -70-degree container on the airplane, it's difficult to transport like on the ground with the same level of the quality control.
I mean, I think just to kind of say what we all know, this is going to be the largest and fastest, like semi-coordinated rollout of a health intervention, or possibly anything, maybe save like the last Harry Potter book, that we've seen in the world by like orders of magnitude, right? Like this is unprecedented, what we're going to attempt to do in the next months and years, hopefully not too many years. So there are a ton of challenges that come with that. And Kun talked about a lot of them. And then each of those challenges has kind of a governance or a coordination piece. And so, you know, looking from a COVAX perspective and from some of the work that they're trying to do in figuring out these logistical challenges, every country is going to have a detailed distribution plan. Different parts of countries are going to have detailed distribution plans. They may need different plans on how to reach different segments of the population. It's the furthest thing from one size fits all you can imagine, because it's literally down to like road quality in different places. The nature of the vaccines that we have, and two of the first, it so happens that two of the first vaccines where we have full data and likely to be two of the most effective vaccines are the Pfizer and the Moderna vaccine. You know, how do we balance the timing of vaccine availability and their efficacy against considerations like price and storage requirements and dosage, whether it's one or two, and recognizing that these first vaccines that we have may not be the best suited vaccines for large parts of the world. So what do we do there? Do we go ahead and start frantically trying to invest in the capacity to build out, you know, super cold, like sub-Antarctic temperature distribution chains? Or do we hold out and kind of save that money for buying actual vaccine doses, because money is also limited? Then just beyond that, there are regulatory challenges. So like now we have a vaccine, which is amazing. How do we get it approved all over the world? And this becomes an issue for stuff as mundane as like labeling. Can you use the same label on the vaccine everywhere in the world? Or does every country have its own label? And this is like actually a sovereignty issue, right? And then there are other sort of legal challenges, and particularly about indemnification and liability and no-fault compensation, these protections that the pharmaceutical companies, the vaccine makers want, because this is a new technology. They want protections for it. You know, many parts of the world have a legal structure that's set up to give that to them. Many parts of the world don't. And trying to create or figure out exactly what they're going to be in different countries is, you know, a whole huge legal nightmare. And then there are going to be allocation challenges at the country level within countries, things that we're seeing addressed by national regulatory authorities like the CDC now, who counts as an essential worker, who counts as high risk. And then globally, COVAX has said that the first 20% of the vaccines that they get will go out to all countries equally. But after that, there's going to be a sort of global framework for allocation based on risk and need and some other factors. And WHO is leading the work on developing this. And as far as I know, we haven't quite seen it yet. But whatever it is, it's going to be controversial. Right. And in the process of trying to develop this, there's a tension between speed and ensuring expertise and not having it be kind of an open, free-for-all discussion that moves very slowly, as most things at WHO are, versus the need to have transparency and to have buy-in from countries and from civil society, and to make sure that there's a feeling of sort of trust and legitimacy in this framework that comes out that will ultimately, be guiding access to arguably the most important healthcare product of our time for billions of people.
One of the issues is that what we've seen in the last couple of months is this concept of pandemic fatigue. I think everybody feels it. Everybody knows what it is. And this incredibly positive news about really, really amazing phase 3 trials for so many of the vaccines that we've seen so far has really made, I think, everyone feel kind of like, oh, we're really almost there. And we are almost there, and it's really encouraging. But I think one thing to keep in mind is a vaccine is not vaccination. A lot of people say this, but it's really, really true. There's a big difference between the vaccine that we have in that super, super cooled subantarctic temperature, minus 70 degree, freezer, and a population that's actually vaccinated. So estimates suggest that somewhere between 60 and 70% of people probably need to be vaccinated or otherwise immune for us to have this kind of what everyone speaks of as herd immunity, or where we can really breathe and start to kind of relax, and that's really far away. And there are a couple of signs, I think, that suggest that we can't let our guard down. So global polls of people in 17, or I think it was 17 countries, and a lot of countries with a high proportion of the whole global population have suggested that actually the trust in the vaccine has been falling in recent months, which is a bit concerning. This is even just since the start of the COVID-19 pandemic. About slightly less than 3/4 of people say that they will take the vaccine if it's available. And that's as low in some countries, like where I live, France, as just over 1 in 2. And that's not enough. And that is assuming all of those people who say they're going to be vaccinated can get a vaccine and oftentimes can get both doses of the vaccine, right? So, I think that's another point that we need to be thinking about as well. Many of these vaccines are 2-dose vaccines. And even with 1 dose, you're probably somewhat protected, but you really need people to get both doses. And that's a whole nother massive kind of logistical challenge to make sure that people come back for that second vaccine, that they know which vaccine they got the first time. I think many people who are going to be those who need it the most might be those who are going to find it most difficult, let's say, to have the time to go get that second vaccine, keep track of which they got. And so this issue of vaccine hesitancy, I think, is really, really critical. The fact that basically 1 in 4 people says, I don't think so at this stage, is really not great. And this is an issue that is not unique to COVID. This is something that we've been seeing around the world really growing in recent years. One reason being likely that in many countries, a lot of these vaccine preventable diseases are largely gone. And so it's hard to remember why we really need a vaccine, and it's easier to kind of overweight what the possible side effects could be. So in WHO, for example, in 2019 actually identified vaccine skepticism, vaccine hesitancy as one of their top 10 global challenges. So that was pretty well timed, but incredibly correct. But at the same time, I think that this is a really big opportunity. If the vaccine goes right, people see what the value of a vaccine really is. We haven't had an event like this for a really long time, where getting that vaccine and it coming out and seeing that you're okay really kind of underscores the importance of these vaccines. At the same time, it's incredibly complicated because we have so many different vaccines out right now. And oftentimes, one kind of almost anecdotal story of a side effect that often won't even be linked ultimately to the vaccine can kind of take on a life of its own and really impact the likelihood and the propensity of people to be vaccinated. We've seen this in Japan, for example, with the HPV vaccine a number of years ago, and it's been incredibly difficult to get people to be vaccinated, even though we see cervical cancer rates rising among young women. So I think, all this to say, it's just so positive that we have all of this good news about vaccines. It's so much better than I think we would ever have imagined like a year ago. And I can't imagine how we would be kind of facing this winter if they'd all come out badly. So I think it's incredible, incredible news. But at the same time, the logistical challenges and overcoming people's, the issues around vaccine hesitancy and trust, I think is incredibly, incredibly important. And I think this also ties as well to this issue of behavioral compliance, about wearing masks. I think a lot of this comes down to communication, and expectations management, and also the population's trust in how governments have dealt with the pandemic so far. And I think one thing that's interesting about COVID-19 is that it's trust that's not only in the health response, but this is such a bigger issue than only health. I mean, health is the central point, and we've lost far too many people, and far too many people have developed COVID, but it's also become, an economic crisis. And people need to trust that if they're going to, that this is a two-way contract, that if they're going to follow these rules and regulations, if they're going to have an impact on their well-being beyond their health, on their livelihoods, for example, for restaurant owners, that their back is going to be taken care of at the same time. And so it's not only thinking about, what is the health impact of this, but it's also, I think we need to take a step back and think about kind of the well-being more broadly as well. Because where people feel, for example, that their back is against the wall, that they're being told to close their restaurant, even though they just invested $100,000 in outdoor seating, and if they close, they're on the street, it's a very different situation. And I think that's a very different scenario in which somebody's not necessarily complying than if they know that they're going to get 80% of their salary and that their staff is going to be taken care of. So when we think about kind of compliance, I think it's incredibly important that expectations are managed, that we're not all going to be out in February, the way that life was, or even very possibly, this time next year. I think we really don't know. I think that the speed at which we were able to develop these vaccines so far has been incredibly positive. And I really hope that the kind of logistical side of this is also managed in a similarly positive way, but it's incredibly, incredibly complex. And I think we've seen throughout this pandemic a lot of areas where health systems and governments have kind of tripped up. And there's still a long road ahead of us. And it doesn't mean that it's not positive, but I think, keeping in mind, reminding people that they can't quite let their guard down now. And if you do now, that it's going to be a lot longer.